Thank you, Mark, for your excellent commentary. I had the pleasure of speaking with Mark the last few years around Illinois, and he is a patriot. Thank you, Mark, for your excellent commentary. I had the pleasure of speaking with Mark the last few years around Illinois, and he is a patriot and an extremely informed expert. I'm going to share some things with you tonight that you have never heard before. They're going to make you angry, and I hope that you share that anger and you use it as an impetus to support everyone who supports repealing this legislation. There's a website where you can go. It's called SenateConservatives.com, and that site contains all of our senators who are running for Senate positions, and these are the people that have committed to repeal Obamacare. Why should it be repealed? Let me just piggyback on what Mark said. Mark talked about doctors having their reimbursement ratios reduced more and more by the federal government, whether they take Medicare or Medicaid. Has anyone ever heard of a man named Richard Foster? Richard Foster is the chief Medicare actuary. So this is as high as you can go in the government's Medicare program. Richard Foster did an assessment of the Obamacare legislation, and what he found is that the Obamacare legislation is not just going to cut $560 billion. We've all heard that number, right? Well, that's what they were going to do, and they're going to do it very soon when they decimate the Medicare Advantage program. So if you know anyone who has Medicare Advantage, senior citizens, and you enjoy that program, tough, because it's going away. When you hear the $560 billion number, that's what's being cut, is the entire Medicare Advantage program. Now, this should make you angry. That was scheduled to happen next month, in August. Did you know that because the elections are coming up, and if senior citizens around this country knew they'd be losing their Medicare Advantage programs before the election, that would be very detrimental to President Obama? Do you know what he did? He scheduled it for after the elections. But it's not just that. According to Richard Foster's assessment, the Obamacare legislation over the first 20 years will cut $4.95 trillion from Medicare. Not million, not billion, trillion. Worse than that is his assessment of what the government will do to physicians. According to Richard Foster's assessment, Obamacare will reduce the amount that the federal government pays to doctors who take Medicare today to less than what it currently pays to doctors who take Medicaid. Now, if you're a physician in Medicaid in Illinois who takes Medicaid, when's the last time you were paid by the Medicaid system? In Illinois, our doctors have been waiting for more than a year. But it's far more detrimental than that to our senior citizens. And I want you to pay particular attention to this and then share with every senior you know. In Mr. Foster's assessment, because Medicare, the reimbursement ratio the government pays to doctors who take Medicare, will be reduced to less than what it pays to doctors who take Medicaid. There were two studies that were completed. One was the American Academy of Cardiology study in 2005. And that study revealed that patients who have surgery on Medicaid are 50% more likely to die after that surgery than those who hold a private health insurance policy. Now, why is that? That's because they're not getting the follow-up treatment that they need after that surgery because the doctors aren't being paid. So as soon as that study came out, the government got those results. First thing they had to do was put more big government on it and fix it. Can't have that statistic. That makes us look bad. Fast forward 4 years, the University of Virginia is commissioned to do a follow-up study. In 2009, you are now 97% more likely to die after surgery on Medicaid than you are with private health insurance. Now, this is before we are about to add 16 to 25 million more people onto our bankrupt Medicaid rolls. Now, they crucified Sarah Palin for using the term death panels. I don't need to use the term death panels because I can run the numbers. And I know what that's going to do to our nation's senior citizens. And who's going to be paying for all of it? It's not going to be our senior citizens. It's going to be the young people. When I speak around the Midwest, I look at the audience and I find very few young people. They don't realize that all of this extra spending The $5.2 trillion that President Barack Obama has spent in the last 3 years is all on their shoulders. And yet the president has the gall to call them free riders, when in reality they'll be paying for all of this. Because the Supreme Court, which used to be our safety net, decided to invent a brand new taxing power, which you will find nowhere in the enumerated powers of our Constitution, Article 1, Section 8. In fact, they didn't even define what the tax was. It's not an excise tax. It's not a capital gains tax. It's the John Roberts tax. It's the tax for doing nothing. It's the same thing as walking into the drugstore and the guy at the counter offers you a pack of gum and you say, no thanks. He says, that'll be $2.50. Do you understand what they've done? And they didn't even do it under Commerce Clause. So because the Supreme Court has betrayed us, and the sitting Supreme Court Justice, Chief Justice John Roberts, who by the way was the swing vote. You see, we had 4 conservatives, even Kennedy on our side. Roberts betrayed us. So now that we don't have that safety net any longer, it is now up to us. And the only way to repeal Obamacare is to vote for those people who are running for the Senate, who have been vetted by people like the great one, Mark Levin. When you donate to those candidates, if they're in your precinct, for God's sakes, phone from home for them and knock on doors for them. Because if we do not get the 50 plus 1 seats necessary to repeal Obamacare, we do not elect Mitt Romney for president, Obamacare will be rapidly implemented over the next 4 years. Try to overturn it in 4 years from today. This is how essential it is. So it is up to us. Now, every time I call the president a liar, my friends on the left, which I have done, love to call me names. You're a racist. I'm still yet to figure out what a racist is, but I'm called these names because I dare to disagree with the president's policy. Here's why I disagree. The president told us that in order to solve pre-existing conditions, we need to pass Obamacare. Because remember, he told that story about the man from Downsgrove, Illinois, Otto Raditz, who had his, quote, raise your hand if you remember this, had his coverage delayed, his treatment denied, and he died because of it. Anyone remember that? Right from the State of the Union speech? Not the one where he insulted our Supreme Court justices. Oh no, not that State of the Union speech. The one before that. Remember that? Would you like to know the truth about Mr. Otto Raditz? Mr. Otto Raditz bought an individual health insurance policy. And on that policy, he did not disclose the truth about a condition that he had prior to that policy purchase. The insurance company did a pre-existing condition review. They found out that he had a condition that, had they known it, they would have denied him coverage for health insurance. So in other words, he committed insurance fraud, which is the only time that an insurance company can drop your coverage when they find out you have pre-X. So the true story is, his sister went to bat for him, and she called the State Department of Insurance. She called and then they called the insurance commissioner in the state of Wisconsin, where Assurant Health Insurance Company resides today. And they were the insurer for Mr. Otto Raditz. Guess what the true story is? Even though the insurance company had the legal right to rescind his coverage, did you know that they never did that? Did you know they paid his claim for 4 more years, and then he died? So if the president can lie to us about something so grave, is it possible he could lie to us about other things? Yes. Yes, he can. For instance, pre-existing conditions. Where did pre-existing conditions come from? Anybody know? Was it the big evil health insurance companies that caused pre-existing conditions? No. You know who caused them? Congress. Go back to 1996. Who's heard of HIPAA law? And what's the first thing you think of when you think of HIPAA law? Privacy, right? By the way, privacy, it's now gone. You see, in order for them to ration care properly, as a former head of CMS, the Centers for Medicare and Medicaid Services, an Obama appointee, Mr. Donald Berwick, says, we need that data so that we can, quote, ration care properly. So when you go see your doctor now, he's got a little iPad-looking thingy, and he's putting all your stuff down. It's not going into a paper and then into a file cabinet, so it can be private. You know where it's going? It's all being uploaded to a central agency, which Dr. Neerhoff referred to, iPad. the Independent Payment Advisory Board. IPAD, for all intents and purposes, has replaced MedPAC. MedPAC was a government board that would make recommendations to Congress as to what they would like to cut in our healthcare system to keep us under budget. So MedPAC would make those recommendations. They would go to Congress. Congress would say, whoa, you can't cut Medicare Advantage and totally eliminate that program. You're really going to upset some people. Right? They like that program. Stop. You can't do that. So those recommendations either pass or not pass through Congress. You see, the reason they call Independent Payment Advisory Board the Independent Payment Advisory Board is because it's independent of Congress. You see, these 15 bureaucrats Dr. Nierhoff mentioned that are appointed by Barack Obama, they don't have to answer to Congress. They make those cuts all by themselves. And they're commissioned, for starters, to cut $500 billion from the American healthcare system over the next decade. And guess what? If they can't make those decisions, they can't come to a decision amongst them. It falls to one person to make those decisions, and to make those cuts. You know who that is? Kathleen Supercilious. That's right. She gets to make decisions, right? Isn't that great? You feel comfortable with that arrangement? Would you trust me to make the decisions? Would you trust the person sitting next to you? But that's what we've done. You think our founders thought of anything like that? They're spinning in their graves. Pre-existing conditions, the president lied again. The reason we have pre-existing conditions is when HIPAA law was written. HIPAA stands for the Health Insurance Portability and Accountability Act. Wait a minute, Steve, go back to the third one. Portability. What's that? Portability has protected 90% of the American insured against pre-existing conditions for 16 years. How do you know this? When you are employed with an employer who offers you group health insurance, you are able to carry that coverage when you leave that employer. And so long as you have no lapse of more than 63 days between this group insurance policy and your new group insurance policy with your new group employer, they have to cover all of your pre-existing conditions from day one. So, that law has protected 90% of the American insured. So how do we get pre-existing conditions? That seems to work really well. We got them because they didn't extend portability to individual policy holders. The people who don't have purchasing power, like Motorola with 5,000 employees that can go to Blue Cross Blue Shield and say, hey, I just got a quote from United Healthcare. My premium to you is going to be $248,000 a month. What are you going to do for me? And Blue Cross Blue Shield of Illinois will bend over backwards to get that premium. You can't do that when you're a self-employed person. So you are the person who got no protection against portability by Congress, when you are the persons who should have got it over everybody else. But they gave you no portability protections. You know, the entrepreneur, the small business owner, who couldn't build their business without somebody else helping them. Because remember, to quote Barack Obama, you got a business, you didn't build that. Somebody else built that. Excuse me? Well, you need roads and bridges to operate that business. Excuse me? I paid for those roads and bridges, Mr. President, and you couldn't maintain them without my tax dollars. So, how do we solve pre-existing conditions? Very simple. We add one sentence, not 2,700 pages. Not even one page! One sentence to existing HIPAA portability law that says all individual plans are now protected under existing HIPAA portability law. Done. You will never see a pre-existing condition clause again in this country. Does that take 2,700 pages? Does it take one page? No. And the insurance companies have already said they're going to do it. They want to do it. They much rather do that than have you wait until you get sick and then you buy a plan. Which is exactly what's coming with Obamacare. See, you need no proof of prior coverage with Obamacare. You can wait until you're sick, buy your plan, get the treatment you need, dump that policy, wait until another year goes by, get more treatment, all paid for by who? The few, the crowd, the 53%. You see, those of us who pay income taxes will be paying for all of this. Do you remember when the president was doing an interview with George Snuffleupagus from ABC News? And George Snuffleupagus had the dictionary out and he said, Mr. President, this is the definition of a tax, right from the dictionary. But you say it's a fine and it's not a tax. You remember what Barack Obama's answer was? I reject that definition. Only Barack Obama can reject the definition of something in the dictionary. And at the same time he was doing that, his ambulance chasers were arguing that it is a tax in the Supreme Court. Right? So here's a question. Do you remember when they had a camera in front of Nancy Pelosi and one intrepid reporter had the guts to ask her, is it true that you're going to put us in jail if we don't buy health insurance? Raise your hand. Remember that? And she hemmed and hawed and wouldn't answer the question, right? Well, in reality, the Tea Party found out about that. We rose up, so did people like Americans for Prosperity, so did the Illinois Policy Institute. Americans all over the country said, not in the USA, they ain't going to put me in jail if I don't buy health insurance. So they took it out 3 months before it passed, which presented a unique problem to our statist-in-chief, Barack Obama. Here's the problem. If I can't force you under penalty of criminal fines and imprisonment for not buying health insurance, how am I going to get that fine if you refuse to comply? So he came up with a great idea. I'm going to commission the Internal Revenue Service, and they're going to come after you if you don't buy health insurance. So follow this logic with me. You ready? How many people pay taxes in this country? 53% on a percentage basis. If you don't buy health insurance, what's the ramifications? We're going to hold your tax refund. How do you hold a tax refund? From somebody that pays no taxes! So who's really going to be paying for all of this? The few, the proud, the 53%. Now, is it true that when you are, quote, Barack Obama, denied for coverage for health insurance, you're, quote, left with no options? Is that true? I've been selling health insurance around the United States for 17 years. Not once have I ever not been able to offer somebody health insurance because they had pre-existing conditions. Never! Why? Because when the government dropped the ball and didn't extend portability protection for individual policyholders, the state stepped up and opened what's called high-risk health insurance pools. In Illinois, we call it ICHIP, the Illinois Comprehensive Health Insurance Plan. It is a place where individuals with pre-existing conditions could get coverage for all of their pre-existing conditions and carry a Blue Cross or Blue Shield of Illinois card for 16 years before Obamacare ever passed. So we didn't need Obamacare to solve pre-existing conditions. We had high-risk health insurance pools to solve that problem. And what they need is government grants to help them with premiums, because those premiums are inherently higher because only sick people go there. So Barack Obama's answer to that was, start the new pre-existing condition plan. Let's do that. We're going to make it a federal risk pool for individuals. And even if you have a state-run risk pool in your state, we're going to usurp the 10th Amendment. We're going to come into your state, and we're going to start our new pre-existing condition federal risk pool. Ready to get more angry? The people who were sick, who've been on those state-run high-risk health insurance pools, who are paying inherently higher premiums than people who are not sick, instead of giving them help for doing the right thing and remaining insured, he put $5 billion into his new pre-existing condition plan and made sure that the people on the state pools couldn't get on the new federal pool to get the new lower premiums because you had to be uninsured for 6 months to get on them. How does that make any sense at all? Lastly, I'll close with one more thing. Our friends on the left, again, of which I have none, they love to say, I like those things. You can keep your child on your plan until he's 26 years old. You don't like that. You hate young people. Newsflash, Socrates. Almost every state in this union allowed kids to stay on their parents' health insurance plans until age 26. Some states 30. For years and years and years before Obamacare. Now, you're going to retain probably 10% of what I just told you. So please go to the following two blogs, truthaboutobamacare.com and truthaboutpreexistingconditions.com. And then get out, engage the left, and especially young people, because they're going to pay for all of this. Thank you.